Special Diets, Epilepsy Educational Video Series, Part 1. Introduction. Antiepileptic drugs, AEDs, are considered the most effective treatment for the majority of epileptic patients. On average, 1 out of every 4 patients does not become seizure-free with medications and require other treatment modalities. There are many patients who do not wish to consider or are not candidates for epilepsy surgery for various reasons. In these patients, treatments like special diets and vagus nerve stimulation, also known as VNS, should be considered. What are special diets? There are 4 types of special diets: ketogenic diet, medium-chain triglyceride MCT diet, modified Atkins diet MAD, and low glycemic index diet LGID. Let's take a look at the first diet, ketogenic diet. History of ketogenic diet. The ketogenic diet was developed in the 1920s for the treatment of epilepsy in pediatric age groups. Jim Abrams created the Charlie Foundation to promote the ketogenic diet. His son's severe epilepsy was effectively controlled by the diet. The ketogenic diet still remains one of the major non-pharmacological methods in controlling epilepsy. What is the ketogenic diet? The ketogenic diet is a high-fat, adequate protein, and low-carbohydrate diet that is used primarily to treat difficult-to-control, also known as refractory, epilepsy in children. The original therapeutic diet for refractory epilepsy in children provides sufficient protein for body growth and repair, and just enough calories to maintain the correct weight for age and height. The classic ketogenic diet contains a 4-to-1 ratio by weight of fat to combined protein and carbohydrate. This is achieved by increasing the consumption of foods high in fat, such as oils, nuts, cream, and butter, while excluding high carbohydrate foods such as starchy fruits and vegetables, bread, pasta, grains, and sugar. The ketogenic diet is calculated by a dietitian for each child. Age, weight, activity levels, culture, and food preferences all affect the meal plan. Let us compare. When comparing to regular diet, the ketogenic diet is high fat, low carbohydrates, and low protein. Let's take a look at the second diet, medium-chain triglyceride MCT diet. Medium-chain triglyceride diet. This diet, however, uses oil, giving medium-chain triglycerides as a major fat source. These MCTs give more ketones and are absorbed more effectively, going directly to the liver. As a result, less total fat is needed in the diet and more protein and carbohydrates can be given to the patient. Let's take a look at the drawbacks. More GI symptoms and no difference in efficacy than ketogenic diet. Benefits: efficiently absorbed, carried directly to the liver, and less total fat is needed. More carbohydrates and proteins can be given. Let's take a look at the third diet, modified Atkins diet, also known as MAD. What is the modified Atkins diet? It is a modified Atkins diet which compromises less carbohydrate intake than the traditional Atkins diet and encourages more fat intake. When compared to the regular diet, MAD has higher fat and protein intake and less carbohydrates. This diet is designed to mimic the ketogenic diet, but allows protein, fluids, and calories as much and as often as desired. Seizure control with modified Atkins diet in adults and children. Studies show that after adapting to the modified Atkins diet, seizures reduced to 50% in 27% of adult patients after only 6 months. Among these patients, seizures reduced to less than 10% and 11% of adult patients. When studies over children were done, it was found that seizures reduced to less than 50% and 65% of young patients, and among these, seizures reduced up to 10% of the total seizures in 35% of patients. Let's take a look at the fourth diet, low glycemic index diet, also known as LGID. Low glycemic index diet, also known as LGID. The low glycemic index diet is based on how foods affect your blood sugar level. In comparison with the modified Atkins diet, the low glycemic index diet restricts carbohydrates to 240 to 60 grams per day, and no restrictions are imposed to the amount of fat, protein, and fluids. The low glycemic index diet encourages low glycemic indices less than 50%, carbohydrates like whole grain, bread, and strawberry. How do these diets work? The brain contains a filtering mechanism called blood-brain barrier, which only allows certain molecules to pass through and restrict the others. In ketogenic diet, carbohydrates are restricted and fatty acids are used as the major source of fuel. However, the blood-brain barrier does not allow fatty acids to pass through. The liver uses these fatty acids to produce ketone bodies. These ketone bodies are able to pass through the blood-brain barrier and act as a substitute for glucose. During this diet, ketones are the main fuel for the brain, and they are directly anticonvulsant. Special diets help in some other rare syndromes and conditionings accompanying epilepsy. With failure of 2 drugs, that is refractory epilepsy. Refractory epilepsy patients who are not good candidates for surgery. And if you decline surgery. Implementation. Initiation. Counseling in hospital. Daily caloric intake and the special diet ratio is gradually increased until proper ratio and amount of calories from fat, carbohydrates, and protein is achieved. Continuation. Calorie intake, height and weight are monitored at each visit. Measurement of urine ketones by parents is recommended several times per week. Discontinuation. Possibly in those who are seizure-free, the diet fails as a treatment, and in those with prolonged seizure reduction. Possible side effects, management, and prevention. Side effects: gastrointestinal upset. Management and prevention: symptomatic. Abnormal lipid in serum. Mostly improves spontaneously. Hypoglycemia, hyperuricemia, hypoproteinemia, hypomagnesemia, hyponatremia, hepatitis, and metabolic acidosis. Monitored but usually change is minor. Children fall into lower height and weight percentiles. Monitored. Low carnitine improves spontaneously. Supplement if symptomatic, as in fatigue and lethargy. Bone loss. Prophylactic supplementation of vitamin D and calcium. Kidney stone. Plenty of fluid intake and potassium citrate supplement. Selenium deficiency leading to cardiomyopathy and sudden death. Cardiomyopathy and sudden death happen even without selenium deficiency. Hence, no monitoring for selenium is required. Pancreatitis. Avoid valproic acid, known as Depakote, which is a common anti-epileptic drug. Seizure worsening. Consult your healthcare provider. Iron deficiency anemia. Rare, but have the iron panel evaluated. Increased bruising and bleeding by impact on platelet function. Consult your healthcare provider. But we need your help in continuing to Follow up with an epilepsy specialist. Notice the common side effects of the diet and consult an epilepsy specialist. Monitor your caloric intake and seizure frequency on a monthly chart. Monitor urine ketone levels frequently, and stick to the ketogenic diet by help of a dietitian.
Thank you for your attention.